Welcome to JAT Chat, presented by the Journal of Athletic Training, the official journal of the National Athletic Trainers Association. I'm Dr. Kara Radzak, an associate professor at the University of Nevada, Las Vegas, and your host for today. Today, I'm joined by Dr. Ashley Crossway and M.Sc. Cloe Klaus, who are part of the team that developed a series of articles addressing the role of athletic trainers in providing care to transgender and gender diverse individuals in the Journal of Athletic Training's recent special issue. Dr. Ashley Crossway is an assistant professor and program director for the Professional Athletic Training Program at the State University of New York in Cortland. M.Sc. Cloe Klaus is an assistant athletic trainer at the University of Notre Dame, and Chloe's dedication to equity and inclusion extends beyond their lived experiences as a trans and non-binary person, trying to create a more equitable workplace for all. Ashley and Chloe, thank you so much for joining me today.
Thanks for having us.
So y'all were heavily involved with the part 2 of this 2-part series on transgender and gender diverse patients. Can you give us more information of what this second part includes?
Yeah, the second part is really an expansion on the first part. The first part sets the foundational knowledge. And then the second part of the series really goes into the considerations for the medical affirmation for transgender and gender diverse patients. In particular, how that applies to sports and regulating bodies.
Can you guys give us a review of what is the gender affirmation framework, what all is involved in it?
So simply put, the gender affirmation framework includes 3 components: social, legal, and medical aspects. However, when you look at each one of those aspects, it's really multifaceted. And it's really important to note that a transgender or gender diverse person may choose to engage with some, all, or none of the processes that are described within the framework, which is listed in the publications. And regardless of the degree or the extent to which an individual seeks gender affirmation, their gender identities are valid. We have to recognize that this is often a process, and there are many barriers that individuals face when seeking gender affirmation. So it's not uncommon for someone to pursue different aspects of the affirmation process over a period of time.
I might actually just hop in there as well, not just, different things throughout time as they're able to gain access to it or even potentially afford those services, but also as their gender identity may grow into it or learn that, hey, this doesn't quite work, or I want to do this. And so even throughout a lifetime, they might pursue different services or different aspects of that framework.
One thing you guys mentioned, you already said the word barriers, but really let's kind of dive into what are some of the healthcare disparities that this population will face, and then how can athletic trainers help combat those disparities?
So I have a few stats pulled up from, actually, if anyone's taken our Safe Space Ally training, this is a quick plug. It's available on our CEU platform. But there's several things that LGBTQ in general patients experience, not even just transgender and gender diverse, but 1 in 6 LGBTQ plus patients avoid seeking care from providers because of negative experiences in the past or perceived negative experiences. LGBT youth, 8 out of 10 students are verbally harassed at school, 4 out of 10 are physically harassed. 8 out of 10 trans students report feeling unsafe at school because of their gender expression. Some other stats from the Trevor Project: when you talk about suicide or thoughts of suicide or even attempted suicide, for cisgender men, it's 25% for considering it, and cisgender women 31%. Compared to for transgender women and non-binary folks, 48% of them consider it, and 56% of transgender men. And that's not even including the attempts of it. So this is a population, LGBTQ folks in general, but also transgender and gender diverse patients who have a lot of stats signaling increased need for care around mental health and support. And so just knowing that, how can we help to support them get the things that they need that help them align to their gender identity?
So in part 2, you guys go into a lot of good depth on the different aspects of gender affirmation. And so what are some key components that athletic trainers can expect to get more information about in this part 2 and how it impacts the medical care?
Yeah, so part two, again, really focuses on the medical affirmation. We spend less time talking about the social and legal affirmation process. We really kind of take it as a multifaceted approach, and we try to look at things in different realms. So one of the largest sections we talk about is gender affirming hormone therapy. And both what that looks like, depending on if you're looking for a masculizing therapy or a feminizing therapy, and what the options are, how they kind of present. The ideas, we're not trying to give any sort of medical advice. These are generalizations, and that you would see in the tables that outline, medication dosage forms, how the treatment is initiated, some of the testing that goes along with it. Again, this is just kind of a generalized approach. We're not trying to give medical advice or encouraging athletic trainers to say, this article says my patient needs this dosage. We want to leave that to the interprofessional care team and the correct professionals. Another large aspect that we kind of talk about to help athletic trainers is adverse effects and drug interactions, just so we're mindful of that as we're providing care, and as athletic trainers, we're there to help facilitate and provide care across the spectrum of life, right? Not just sports injuries, but general medical conditions, other medications a person might be taking. So just to kind of bring some awareness to those scenarios as well. And then we spend quite a bit of time talking about gender affirming surgeries and what an individual may choose or may not choose to undergo for themselves. And that's really kind of the big focus from the medical aspects. We do spend a little bit of time talking about nutrition and how that impacts a person's ability to align their gender identities along with the medical affirmation process as well, and to really help a patient reach their goals. And then outside of that, but kind of in the same context, as how an athletic trainer can help navigate sports participation from the medical consideration and the medical affirmation side of things.
Yeah, I think one of the things that stuck out at me as a really great example of what you guys did was just discussing with the feminizing hormones how a patient could be at risk for deep vein thrombosis, right? And giving those really great practical applications of things to keep in the back of your mind with this patient population. Chloe, can you add to this and maybe touch more on the considerations for sport?
Sure. I think it does a great job of, again, as Ashley had said, just giving the athletic trainers knowledge around some of the things that their patients might be doing to affirm their identity or their gender identity, but then also consider, hey, they're athletes too who are trying to compete at the top of their level, and how that might affect them. So even taking testosterone, right, puts someone at risk of increased tendon injuries. So knowing that, and how can you help manage that if you're noticing that pop up? Some conversations with the interprofessional care team as far as how to manage those things. Some things that we talk about also are some folks who are assigned female at birth might do binding to make their chest flatter. And if they're doing that while also participating in sport by wearing extra sports bras or making more compression, are they more prone to having some type of compression injuries or lacerations, or are there things to the skin because they're doing those types of treatments? So just being aware of some things that you might not even think that you need to ask someone to see if they have an injury that you could be helping them with. So in that aspect. And then as far as actually navigating when you're talking about the world of transgender or gender diverse patients participating in sports, around all the legal considerations or sporting bodies, governing sport bodies with NCAA or different high schools, and then also legal considerations. It's a very complicated mess right now, and there's nothing we can say on this on this podcast, unfortunately, that's going to tell every athletic trainer exactly how to navigate that with their patients. But other than just being aware of what governing body you're working under with your athletes, being aware of those rules, if there's certain ones as far as monitoring different gender affirming hormone therapies, making sure that you have that information for the athlete and helping them get through that process so that they don't have to do it alone. And then again, can you help make that landscape better for the athletes that you are providing care for?
So what are some of the big things that if somebody is walking away from reading this, that you really hope that they get, the key takeaways?
For me, I think it's just being aware of how much it takes to go through this process, just to be yourself, right? If you happen to be cisgender and you've never thought about any of these things that it takes just to present to the world who you believe you are, and who you know yourself to be, it just takes a toll, right? Being aware of the social determinants of health and the healthcare disparities that this population of folks face day to day, let alone if we're talking about not being, their pronouns not being honored or being dead named and someone using the incorrect name, or all the other little things that can pile up and add on top of them trying to be an athlete and you trying to take care of them as your patient. Just being aware of their experience and how can you help to support them through your own education, starting with reading these particular articles, listening to this podcast, and continuing to do the work to support the people that rely on you, that you care for.
For me, I think this article really, the take-home message I want is for athletic trainers to realize they really have a role and they really have a purpose as a healthcare provider in helping transgender and gender diverse patients, whether that's from being an advocate and an ally or to help facilitating the interprofessional care team, as well as working with medical compliance and eligibility. These are all things as athletic trainers we've done with different patients in different aspects. And it's something that we can really have an impact on for transgender and gender diverse patients as well. There are a number of things we can't, paint in a black and white picture. It's this or that. But I think between the two articles, it really helps give athletic trainers some direction and really help fill the gap of knowledge that we've learned about both all as being members of the NATA LGBTQ Advisory Committee, but also the questions we fielded from colleagues, other professionals. So that's what I really think the take home is like this paints a nice picture of how you can help provide some of that information to contextualize it. And the athletic trainers really do have a role in advocating for our patients.
Thank you. Yeah, you guys did a great job as a jumping off point for people to start their education on this topic. So thank you. And just to remind everybody that this is available free, as is all of the Journal of Athletic Training's offerings. And again, thank you all both so much for joining me today. Chloe and Ashley, I really appreciate you taking your time.
Thank you.
Thank you so much.